Welcome back. Today we're going to introduce you to a group of doctors who decided to redefine the way they offer health care. From the ground up, they built a medical clinic that offers highly specialized care, including a women's center with the goal of exceptional care.
Recently, Molly visited SAAK Health in the heart of Brookfield, where board-certified docs give every patient the attention and treatment they deserve. Take a look.
I'm here with Dr. T. He's an interventional cardiovascular specialist. And we're so excited to be here, and I'm excited to learn about SAAK Health.
I've been a physician for more than 25 years, and I've been an interventional cardiovascular specialist. I used to work for a big healthcare organization, and I started to see that access has become such a major issue for patients. We tried to form an organization where they could get their specialty care comprehensively from top to bottom, from initial consultations to their laboratory testings, to where they can get the procedure or any surgery needed, they could get it in one center, one building, one place. So access becomes very, very easy. In our center, we have a surgery center where we can have our own cath lab, full-fledged, where we can do procedures for your heart and for vasculature for the whole body. And Dr. Koduri has got her own operating theater where she can perform all her surgeries. And we have upstairs, we have a wound care clinic with hyperbaric chambers where top-notch wound care along with hyperbaric treatments are provided.
What's your goal for SAAK Health?
My goal, as I said, was to give super specialty care right here in one building at one place, one given time, so that patients are treated in their neighborhood rather than them going to the specialist. We are trying to bring the specialty care to them.
We just talked to Dr. Tumuluri, and now we're with Dr. Koduri. We're going to talk about women's health issues.
Yes, exactly. As a urogynecologist, I deal mainly with bladder problems in women. The main things that I treat are things like urinary incontinence and pelvic organ prolapse.
It's a pretty common issue for women, isn't it? Especially if they've had children.
Yes, it is. Up to about 30% of women can actually have a problem with it. It's rarely talked about by women and rarely discussed. So just having a clinic out there that actually says the word incontinence actually draws in some people.
What is your goal with this clinic and having this specialty here at SAAK Health?
The goal is to try and provide that access to patients and make it okay for them to talk about it.
You also can do procedures here. You have a full operating room, exam room, all of those things right here where you see patients.
That's correct. We are currently upstairs in the clinic area where we would see patients, do any of the diagnostic testing that would be needed. And in many cases, they can have their procedures done downstairs in the surgery center.
What would make you feel really good to hear from a patient who visits you here?
I would like to hear that they're very comfortable talking about their issues and getting them addressed here.
Now we're going to talk about a different specialty, and that is wound care. Dr. Asija, you have that specialty, and that's what you bring to SAAK Health. What types of issues do you treat?
We treat chronic wounds. The first one is arterial ulcers, venous ulcers, diabetic foots, diabetic ulcers, pressure sores, and also trauma wounds.
You mentioned trauma wounds. What does that all entail? What types of wounds?
We usually treat chronic wounds that are trauma-related, like a motor vehicular accident, a road accident, post-surgical traumas, non-healing ulcers, and also burns.
Is there a lot of stigma around wounds and wound care?
Yes, unfortunately, yes.
How do you manage that with your patients? Because I'm sure that's an aspect of what you talk to them about and try to educate them about.
We try to have a holistic approach. We provide comprehensive treatment and multidisciplinary approach to treat these patients.
You have a hyperbaric chamber here, which is incredible to have it at this location. How does that help you in treating patients who have a wound?
Wounds can be treated by oxygen and blood supply. So the oxygen in the hyperbaric chamber under pressure will give you optimum oxygen to treat these wounds and accelerate the process of healing.
Do you see pretty phenomenal results when you use the hyperbaric chamber?
Yes, we do.
Why did you decide that you wanted to be part of SAAK Health and do a specialty clinic here?
As my colleagues, I also come from corporate world, and I felt that in the whole scheme of things, the one person who was ignored was the patient. In SAAK Health, we want the patient to be first, and that's my priority. I want my patients to be healed in a comprehensive manner.
So like they mentioned, SAAK Health is bringing specialty care to the neighborhood. Their 4 specialty clinics are all on one campus in Brookfield, including wound care, the Women's Center, Ambulatory Surgery Center, and the Cardiovascular Associates. For more information, here's the number to call. It's 262-444-5148. Or check them out online at SAAKhealth.com. It's really amazing. I mean, the specialties that these doctors have, and the fact that they got together and decided to leave sort of the traditional world behind and do this, I mean, to get that kind of specialty care where you can just park right there in their office, walk in, and even have surgery is the facility is, it's like a hospital, but much more easily accessed, which is incredible.
That wound care and the hyperbaric chambers, like seriously,
yes,
that's some
incredible
serious stuff.
Yeah.